Do we have the polling questions ready to go? Okay. So I know on your schedule it says that next up would be the reporting adverse events, so that's why I just covered that at the end of the last one. So instead, we're going to bring Dr. Richardson up to do some poll everywhere. The instructions are on there, and he's going to walk us through that as well.
Great. Thank you. Well, thanks for giving me the opportunity to be in front of you today, and we're going to do question and answer polling. So you can see you're going to respond via text to 22333, and we'll see how people do today. Well, the first question is, which of the following is most likely to lead to a complication when using radiofrequency ablation on a liver lesion? The first answer is injury of the operator due to capacitive coupling. The second, injury to the skin due to direct coupling. Third, injury due to malignant hyperthermia. And fourth, injury to adjacent structures due to heat. All of you able to, some of you are up to the texting task. All right. Can we see what the audience polled, please? So, wow. Many of you, a lot of you have many different answers, but the biggest answer was the last one. Can we see the actual answer next, please? Do we have the actual answer coming up?
No, those won't come up on
Okay.
Those are just, this one.
Well, it is happened to be the last answer is correct on this one. So most of you did get that right. It is the heat that can cause problems. All right. Yeah, the radiofrequency ablation isn't something where you can get easy capacitive coupling, because that requires having, you know, a capacitor and something across the top of it to allow it to cross the electricity, to cross the insulation. And the injury due to skin doesn't happen because the full deployed device is inside the liver, and malignant hyperthermia, which none of you guessed, it's not something that's attached to this device. Next question. The coagulation mode on the electrical surgical unit, number one, uses an interrupted high voltage waveform. Number two, uses a continuous low voltage waveform. Three, uses an interrupted low voltage waveform. And four, uses a continuous high voltage waveform. We had a very good discussion on this, and hopefully that we have this fairly well situated in your minds. Now, wait a minute.
That's what you said, but I said it more directly.
All right, let's see the answers now.
Yeah.
Very good. So everybody was listening to the lecture. Excellent. Next question. All of the following conditions are desirable during bipolar electrical surgery except 1, developing of proximal thrombus. Number 2, elimination of the tissue cooling via obstruction of continuous blood flow. 3, electrical bypass via tissue compression. Or 4, localized cellular and tissue heating. All right, let's see how the audience did. Wow, we got a split answer today. Certainly you do, certainly does develop a proximal thrombus, but really the The problem is that if the electrodes of the bipolar are too close together, you get an electrical bypass, and it's not actually going through the tissue anymore to cause the coagulum to form. When you get that bypass, you no longer are coagulating anything because it's going directly from A to B. So that's not desirable, and that, I believe, is the correct answer for this question. So we don't want you to bypass creating the coagulum. Does that make sense to everybody?
And developing of the proximal thrombus helps you get
Yeah. Yeah, that would be something that helps promote the hemostasis. All right, next question. If a bipolar device becomes adherent to the target tissue, the operator should, 1, increase the power output of the ESU unit in order to evaporate the adherent layer tissue, 2, turn off the ESU and peel the jaws off the bipolar device from adherent tissue, 3, repeatedly open and close the bipolar device jaws until the tissue is dislodged, and 4, reactivate the bipolar device under irrigation to create steam bubbles. All right, let's see what answers you have for that. Yeah, so the correct answer is the 4th answer, to create some steam to try and get the bipolar device to let go. Repeatedly opening and closing the jaws could cause the coagulum to open up and cause bleeding. And in fact, the first time I used one of the bipolar devices and it was on the adrenal vein. And I opened it, and it was stuck slightly to the jaws that was opening, and I didn't notice that. So that vessel completely opened up. I grabbed it and sewed it closed, fortunately, but that was a very sweaty moment for me. So repeatedly opening and closing the jaws is not the correct answer to this question. It's to put a little bit of fluid there and to try and open it in a way that will help it dislodge with the steam that's created. All right, next question. The following is true with regards to bipolar device use, except when overlapping a seal, a small segment of fresh unsealed tissue should be left in between the 2 seals to reduce collateral damage. 2, a wide margin of safety should be utilized due to lateral thermal spread. 3, very close proximity to high conductive materials such as metal clips and staples should be avoided. And 4, caution should be taken when using these devices in patients with atherosclerosis.
should be another 100%. Let's see.
All right, let's see your answers. Oh, not bad. All right, so it is kind of nice to leave unsealed tissue between when you're using it twice, but you do have to be careful that you have enough room laterally not to have collateral damage if you are to do that. So usually our seals are sort of on top of each other. And with atherosclerosis, that potentially, if you're using on a vessel with atherosclerosis, that will keep the vessel open rather than allow it to seal. And certainly if you're using in the proximity of metal, that's going to cause very, very high temperatures and increase spread of heat and potentially cause a complication such as a leak or something.
So I don't think we have a lot of accept questions. These accept questions are difficult because they're a trap. Look at the stem of the question, it says accept, and then you get confused. So in the test, you won't see many of these accept, or more than one is true answers. Okay? Just so you know.
Yeah, when we're trying to be demonstrative, they're very good questions, but in appropriate test-taking circumstances, they're inappropriate questions, and you won't find them on a real test.
And I think for the wide margin of safety, that may have thrown some people off. We've talked about that 1 to 3 millimeter margin, so wide maybe was overstating it a bit, but the point is that you still need a margin of safety. You know, just because it's a bipolar device doesn't mean that there's no thermal spread. So that's kind of what it was getting at there.
So who does not understand the right answer to this question? Okay, the right answer is the top one, the first one, right? Which one did you choose? Number 1. No. Number 2. Yeah, unfortunately, number 2 is true, and number 1 is the one that's not true.
All right. Yeah, that's the accept phenomenon.
I think we have time for one more, and then the rest of these questions we'll do at the very end of the session.
So which of the following are true? Bipolar electrosurgery is radiofrequency. Monopolar electrosurgery is radiofrequency, both or neither. Again, another type of question that you won't see on a real exam, but just to see if you were listening. All right, let's see the answer to that, the answers to that. Yeah, so they both are radio frequency.
So the current in electrosurgery is always the same. It's type of radio frequency alternating current.
Yeah.
No matter what the type of device you use in electrosurgery, the radio frequency ablation device, monopolar device, bipolar device, vessel sealing device, if it's electrosurgical, it is a radio frequency 300 to 500 hertz, 1000 hertz alternating current. Make sense?
But cautery, which uses heat, is not. And the various agitating devices like the harmonic scalpel and so on are basically using what we used to use to create fire back in the Stone Age, right? Rubbing 2 sticks together. All right. Well, thank you very much.